Hello all, good day. Welcome to Occupational Safety and Health, OSH Risk Assessment, online learning module by Department of Safety and Health, Ministry of Human Resources Malaysia in collaboration with Social Security Organization. Please sit back and relax, enjoy the course. What is the purpose of OSH Risk Assessment? The main purpose is to establish the minimum requirements and duties for implementing workplace risk assessment in Malaysia, and provides guidance on its implementation. Next is to provide a systematic and objective approach to assess hazards and their associated risks that will provide a method to control the risk. Thirdly, to comply with general duties as prescribed under the Occupational Safety and Health Act 1994, Act 514 and OSH Risk Management Regulations 202X. Now, let's talks about the scope of the application. This risk assessment shall apply to all place of work in relation to OSH risk assessment under Occupational Safety and Health Act 1994, Act 514. Let's continue with definition of terms. What is hazard? Hazard is defined as source with a potential to cause injury and ill health. This can include articles, substances, plant or machines, methods of work, the working environment, and other aspects of work organization. Injury and ill health is adverse effect on the physical, mental, and cognitive condition of a person. Hazard identification is the identification of undesired events that lead to the materialization of the hazard, and the mechanism by which those undesired events could occur. Incident. Incident is occurrence arising out of or in course of work that could or does result in injury and ill health. Low risk level. Low risk level is any risk assessment resulting in low or acceptable risk. Medium risk level is any risk assessment resulting in medium or tolerable risk. High risk level is any assessment resulting in high or not acceptable risk. Principle of prevention is a framework to identify and implement measures to control risk. Residual risk is the remaining risks after implementation of risk control. Risk assessment is the process of evaluating the risks to safety and health arising from hazards at work and determining the appropriate measures for risk control. Risk assessor is a person who is competent to carry out risk assessment. Risk control is the measures to avoid or reduce the risk associated with a hazard. Risk matrix means a matrix to classify a risk level for subsequent control with severity and likelihood levels as the two factors determining risk. Commonly 5x5 matrix. The organization may use other matrices that are suitable and relevant to their workplace. Safe Work Procedure (SWP) means any procedure for carrying out work safely, and includes any procedure which is to be taken to protect the safety and health of persons in the event of an emergency. Substitution means the replacement of any hazardous material, process, operation, equipment or device with less hazardous ones. Next one, we will talk about employer duties. This topic consists of 18 points. The first employer duty is to ensure that a risk assessment is conducted on risks associated with any activity in the workplace including at design stage. Secondly, is to ensure that any risk assessment is conducted by a risk assessor. Thirdly, is to ensure a risk assessor conduct risk assessment in accordance with the manner specified in the ICOP or any other manner which fulfill the intention of the ICOP in managing the risk. The fourth is to ensure or approve the risk assessment conducted for his workplace. He also reviews and approved the risk assessment conducted by the contractor or supplier whose work has been assigned or the last one is to ensure that the risk level is not rated high risk when approving work to be carried out. Next one is to stop activity and take immediate action to control the risk so far as is practicable to medium risk level or low risk level before carry out any activity if the assessment conducted indicates high risk level. Furthermore, is to take measures to control the risk as required in para 5.5 as recommended by the risk assessor. To require the risk assessor to provide regular updates on implementation of risk control measures and highlight any specific precaution to be taken to reduce or avoid identified risks. To ensure the persons in charge to implement the risk control within the timeline. To ensure all work activities have established and implementing SWP. The next four of employer duties are to ensure that all persons exposed to the risks are communicated on as the following: the nature of risks, any measures or SWPs implemented, and the means to minimize or avoid the risks. Next one is to ensure that the effectiveness of the risk control measures is monitored. To update the risk assessment form if the risk control measures are inadequate and ineffective after the implementation, by obtaining more information and or modifying controls. To maintain OSH risk management documentation and to record of control measures, SWP and training that were implemented. The number 15th is to ensure safety and health responsibilities in the job descriptions of employees to be specified and ensure that these responsibilities are effectively communicated to all employees. Ensure that all new employees are given appropriate and sufficient orientation and OSH training to equip them with the relevant knowledge, skills, and abilities to succeed in their positions. Then to implement programs that support and maintain employees' safety, health, and well-being. And the 18th is to ensure that OSH training and other related OSH risk management records is available and maintained at the workplace. Risk assessor. Risk assessor should assist the employer and appointed person in coordinating OSH risk management within the workplace. The risk assessor should provide regular updates on the appropriate risk control measures implemented and highlight any specific precaution to be taken to eliminate or reduce risks to the employer, preferably monthly but no less than once a year. To obtain approval from the employer or the appointed person for the implementation of risk control measures. Assist the employer to ensure that the risk assessment forms is prepared in accordance with the ICOP. Employees are to adhere to the measures stated in the risk assessment. Other than that, employees also need to report to their superior if there's any incident, so that prompt action can be taken to address them for the purpose of reviewing risk assessment. OSH risk management process of 5 phases, which is preparation, risk assessment, implementation, record and review. First one is preparation. It consists of formation of OSH risk management team, scope of risk assessment, and gather relevant information. Second one is risk assessment. It consists of hazard identification, risk evaluation, risk control, risk re-evaluation. Third one is implementation. It consists of risk assessment approval, implementation actions, communicate the hazards identified and their control, audit. Third one is record. It consists of must be maintained and available upon request. Fifth and last one is review. Must review risk assessment on regular basis. First process phase is the preparation. Preparations phase included formation of risk management team. Members of organizations that included is designers, engineer, architect, management staff, technical personnel, supervisors and maintenance staff. Second point is any other OSH personnel. For example, safety and health officer, site safety supervisor, OSH coordinator, and safety manager, where suitable. Also including contractors and suppliers. The member of OSH risk management team must have an appropriate knowledge and experience of the work to be assessed and be multidisciplinary, diverse with representation from major stakeholders of all the workplace functions except for self-employed person. Scope of risk management divided into two steps, which is determine boundaries and identified process. Firstly, we will talk about determine boundaries. First thing first, scoping is the step of identifying a convenient unit or boundary for assessing and controlling risks at the workplace. The process may be as simple as dividing a workplace or project into its distinct parts, i.e. departments, divisions or functional areas, and then subdividing each part into self-contained jobs or areas, each representing the unit for the risk assessment. The OSH risk management team should determine the boundaries of the risk assessment, like example, departments, divisions or functional areas within the workplace. Second point is the identified process. Firstly, after determine the boundaries, like example, departments, divisions or functional areas, identify the process and location to be a classified process in accordance with their similarity, such as geographical or physical areas within or outside premises, or stages in production or service process, also not too big. Example is like building a car, and not too small like, example fixing a nut, or defined process likely loading, packing. Last but not least, is gathering relevant information. Once the extent of the risk assessment is determined, relevant information should be gathered. These sources of information on the next slide may include, but are not limited. The information is workplace layout plan, process or workflow chart, list of work activities in the process, list of chemicals, machines and tools used, records of past incidents, relevant legislation, ICOP, standard guidelines or specifications, observations and interviews, OSH inspection and audit records, job safety analysis, process hazard analysis, details of existing risk controls, feedback from employees, clients, suppliers or other stakeholders, safe work procedures or known as Safe Operating Procedure SOP, work instruction and work method statement, safety data sheets, manufacturer's instruction manual, copies of any previous risk assessment that are relevant, medical record, for example, allergy of employees in the workplace or activity being assessed, and past training records of employees. Second phase is risk assessment. The first one is hazard identification. In general, OSH risk management team has to identify hazards through brainstorming, systematic process reviews, process hazard analysis, job safety analysis, job hazard analysis, job observation, workplace inspection, exposure monitoring record, interview workers etc. Take note that OSH risk management team should take into account, but not be limited to: how work is organized, social factors, including workload, work hours, victimization, harassment and bullying, leadership and the culture in the workplace, routine and non-routine, past relevant incident, internal or external, potential emergencies, people etc., other issues, actual or proposed changes in workplace, operations, processes and activities, changes in knowledge and information about hazards. Next one is hazard identification process. Select a process and place it in the risk assessment form, see Appendix A, for assessment. Variations of these forms can be used. However, all information required in the forms has to be documented. Break down process into its work activities to facilitate the identification of all foreseeable hazards associated with the work. These work activities constitute the different steps that make up the process. For each work activities, identify the potential hazards and write down in the hazard column. List each hazard in a separate row in the table. For each identified hazard, select appropriate category of hazard, as per Appendix B, and write down in category of hazard column and identify event and consequence and write down in event and consequence column. For example, this is before and after hazard identification. Second one is risk evaluation. Risk is the evaluation of likelihood and severity of the credible incident or event sequence in order to determine magnitude and to determine risk control. Likelihood of occurrence. Likelihood is an event likely to occur within the specific period or in specified circumstances. This value is based on the likelihood of an event occurring. Likelihood ratings range from most likely to inconceivable. Table 1 indicates likelihood and example using the following values. Severity of hazard. Severity is outcome or consequence from an event such as severity of injury or ill health of people. It can be divided into 5 categories. Severity are based upon an increasing rating of severity to injury or ill health. Table 2 indicates severity by using the following table. Likelihood of occurrence. Taking the existing risk controls into consideration, the OSH risk management team has to rate the likelihood the hazard may cause injury or ill health. When estimating likelihood, the highest possible rating of likelihood should be selected. Estimating likelihood should consider the factors, but not limited to: past accident record, proximity to a hazard, frequency and duration of exposure to a hazard, personal/human factors who performs the task, machinery or task history, workplace environment, reliability of safety features, possibility to defeat or circumvent protective measure, or ability to maintain protective measure, personal or human medical factors. The guidance given in Table 1 should be used to consider the justification of likelihood before rating the likelihood. Table 1 Guide to Likelihood Rating. It consists column of likelihood, description, rating, and factors. Next one is severity of hazard. Taking the existing risk controls into consideration, the OSH risk management team has to rate the severity of the possible injury or ill health. The guidance given in Table 2 should be used when selecting the rating of severity. When using other matrices, equivalent guidance for severity should be used and described in adequate details for adoption by users of those matrices. In an event, OSH risk management team members have difficulty developing a consensus to the severity rating. The team is to gather more information and get advice from an industry expert. On Table 2 indicates severity by using the following table. It consists of severity, description, and level. Next is risk matrix number. The RMN is obtained by multiplying the values of likelihood and severity rating. Values in the L and S columns of the risk assessment form, RMN equals LXS. We're gonna talk about risk matrix. The numeric 5x5 risk matrix is recommended as given in Table 3. Achievable or remote. But the severity is catastrophic or, if the likelihood is remote or conceivable, but the severity is major, the risk assessor must alert the employer and write down specific precaution in remark column. In risk assessment form, Appendix A. The risk matrix used in the risk assessment should be displayed at least once, and preferably at every page of the risk assessment form. This is particularly important when numeric ratings are used, as risk matrix number may represent different levels of risk, with different sizes of the risk matrix. Table 3 risk matrix consists of severity or likelihood, with a 5-stage of marks level. Meanwhile Table 2, recommended action for risk levels, consists of risk level, risk acceptability, and action. Lastly, risk evaluation for health hazards. When assessing the risk of health hazards, for example biological agent, ergonomics and heat, and psychosocial hazard, relevant risk factors should be taken into consideration. Third is risk control. Principles of prevention consist of the following factors. Avoid risks. Eliminate the hazard that gives rise to risk in the first place. Evaluate the risks. Risks that cannot be avoided should be evaluated through a risk assessment to determine the safest method of work. Avoid risks. Eliminate the hazard that gives rise to risk in the first place. Evaluate the risks. Risks that cannot be avoided should be evaluated through a risk assessment to determine the safest method of work. Controlling the risks at source. Control measures should be close to the danger point and effective in reducing the risk. Next is adapting the work to the individual. Design of place of work. Choice of work equipment and choice of working and production methods, with to alleviating monotonous work. Adapt to technical progress. Latest technical knowledge when selecting working methods, equipment, materials and work equipment. Replacing the dangerous by non-dangerous. Reviewing the choices and selecting the ones that either pose no danger to workers or the dangers has been reduced. Developing prevention policy. Developing a coherent overall prevention policy. Collective protective measures. Priority over individual protective measures. Instructions. Describe the risks in the proposed work and refer to the protective measures that should be in place. We're gonna talk about additional risk control. Check the risk level, or RMN, for acceptability. If the risk level is high or RMN is in the high zone, the risk must be eliminated or reduced to a medium or low level by additional risk controls before carry out any activity. When considering additional risk controls to reduce risk, control measures that are higher up in the hierarchy of control should be considered first. Fourth and last, risk re-evaluation with additional risk controls. When additional risk controls have been decided, re-rate the severity, likelihood and RMN values and write down in the L, S and RMN columns in the risk re-evaluation section of the risk assessment form. The re-evaluated RMN should preferably be kept within the medium risk, yellow, or low risk, green zone, where feasible, and not be higher than the initial RMN. Now is the implementation phase, which is the third phase of OSH management process. Risk assessment approval. Employer shall approve the completed risk assessment form. Employer also should compile all risk assessment form in risk assessment from cover sheet. We will talk about risk assessment action. There's our 6 points for this subtopic. The first one is implementation. So far as is practicable, the recommended additional risk control immediately or in specific timeline. Ensure that a plan is prepared to implement the measures. Ensure that the plan is monitored regularly until all the measures are implemented. Ensure that all persons exposed to the risks are communicated on the nature of risks and any measures or SWP implemented. Ensure regular inspections and audits are carried out to make sure that risk control measures implemented and functioning effectively. Ensure an observation is carried out to make sure all control measures are in place and no associated hazard exposed to employee. Second last is the review, which is the fourth phase of the process. When should the risk assessment be reviewed? Risk assessment shall be reviewed if there's any incident occurred, as well when there is any significant change in work process, practices or procedures. Other than that, when new information on hazard is made known, or when directed by the Director General. Now we will talk about part 5, which is about the communication, consultation and participation. First one is communication, consultation, and participation with external and internal stakeholders, including all functions and levels within the workplace, shall take place during all stages of the OSH risk management process. Effective consultation is seeking view between stakeholders in decision-making. Communication also can take various forms, such as meetings, employee dialogues, trainings, notice boards and various electronic means for different groups within the workplace. Effective participation involves two-way dialogues between stakeholders. All employees or other person not being his employee at the workplace shall be communicated on the risks they face and the risk control measures available to manage those risks. Now we will talk about record phase in this process. In this process, every employer or self-employed person shall do the following, which is maintain a record of any risk assessment conducted and any measure or safe work procedure implemented, and make available a record of any risk assessment for examination upon request by the Director General. In this process, every employer or self-employed person shall do the following, which is maintain a record of any risk assessment conducted and any measure or safe work procedure implemented, and make available a record of any risk assessment for examination upon request by the Director General. Part 7 of this process is training. In training phase, every employer or self-employed person shall ensure appointed risk assessor attend training for conducting risk assessment. The scope of training should include it such as OSH legislation, OSH risk management system, hazard identification, risk evaluation and risk re-evaluation, risk control, and OSH risk management record. Now we're gonna talk about list of appendices. This is the example of Appendix A risk assessment form. It should contains department, process, location, assessment date included last assessment or review date. Other than that, the form should also contain risk assessor, RM team member and lastly the details of approval, which is signature, name, designation and date. Appendix B. Classification of hazard. Physical are factors within the working environment that can harm the body without necessarily touching it. They include unsafe conditions that can cause injury and ill health. For example, slippery floors, working at heights with open edges, unguarded machinery and moving machinery parts, electrical hazards like improper wiring, confined spaces with poor ventilation, exposed to temperature extremes, hot and cold, chemical This will present when an employee is exposed to any physical properties of chemical in the workplace in any forms such as solid, liquid or gas. For example, flammable materials, gasoline, solvents and explosive chemical, biological. Associated with working with animals, people, or infectious plant materials. Also who work in schools, daycare facilities, colleges and universities, hospitals, laboratories, emergency response, nursing homes, outdoor occupations, and etc. may expose you to biological hazards. For example, exposed to contaminated blood and other body fluids, exposed to fungi or mold, exposed to bacteria and ergonomic. Occur when the type of work, body positions, and working conditions put strain on your body. They are the hardest to spot, since you don't always immediately notice the strain on your body or the harm that these hazards pose. Short-term exposure may result in sore muscles the next day, or in the days following exposure. But long-term exposure can result in serious long-term illnesses. For example, improperly adjusted workstations and chairs, repeating the same movements over and over, repetitive motion, awkward posture movements, especially if they are repetitive, having to use too much force, especially if you have to do it frequently, and also exposed to vibration. Psychosocial. Psychosocial is a hazards or stressors that cause stress, short-term effects, and strain, long-term effects. These are the hazards associated with workplace issues such as high workload, lack of control, and respect, etc. For example, high workload demands, workplace violence, intensity or pace, respect, or lack of, less work flexibility, lack of control or say about things, lack of social support or relations, and lastly sexual harassment. We will talk about Appendix C, risk contributing factors of health hazard. As you can see, there's a 5-column which is health hazard, biological agents, ergonomics risk factors, heat, psychosocial, and we will explain in details for each of them. First column is health hazard, which is the risk contributing factors. Second column is biological agents, intrinsic hazard of microorganism, pathogenicity, virulence, host range, viability of microorganism, amount of microorganisms present at point of exposure, mode of transmission and routes of infection, ergonomics risk factors, weight of load or force, repetition or frequency of motion, posture, static, awkward, etc., direct pressure on body parts or contact stress, vibration and temperature of the environment. Fourth column is about heat. Temperature, humidity, amount of direct sun exposure or radiant heat, intensity of physical work, physical exhaustion, type of clothing, unacclimatized person or duration of acclimatization, and susceptible individuals, cardiovascular disease, impaired renal function, obesity, alcohol and drug abuse, dehydration, psychosocial. This consists of stress, high workload, tight deadline, depression, hopelessness, hostility, bully, harassment, and discrimination. Next one is Appendix C, additional notes for residual risks and safe work procedures. We will tell us about residual risks. Residual risks are the remaining risks after implementation of control measures. The risk assessor should ensure that residual risks are acceptable and manageable. For example, if the control measures involve the use of safety harnesses and lanyards, a type of PPE, One of the residual risks is that the employees may not anchor the lanyards or check the fall clearance to protect themselves. In this case, the risk assessor may highlight pre-job safety briefing, administrative control as a further measure to ensure that residual risks are further minimized. Next is about safe work procedures. Arising from the risk assessment, SWPS should be established and implemented for work which may pose safety and health risks. The SWPS should include safety precautions to be taken in the course of work and during emergencies, as well as responsibilities of persons involved and provision of PPE. The implementation of the SWPS should be monitored regularly, and the SWPS reviewed periodically to ensure their effectiveness. Safe work procedures must include, but not limited to, title, content, scope, abbreviation, roles and responsibilities, procedure, before, during, after, and emergency situation. References, Act, Regulations, Code of Practices, Guidelines, etc. Necessary personal protective equipment. Required training. Control measures identified in the risk assessment and appendix, for example inspection checklist or form, permit to work, process flow chart, related drawing, etc. This is the example of completed risk assessment form. It should contain department, process, location, assessment date included last assessment or review date. Other than that, the form should also contain risk assessor, RM team member and, lastly, the details of approval, which is signature, name, designation and date. The form also should contain the following, which is hazard identification, risk evaluation and risk re-evaluation. Under hazard identification should be work activity, hazard, classification of hazard, event and consequences. For risk evaluation should be existing risk control, justification of likelihood. Lastly, for risk re-evaluation should contain of additional risk control and person in charge. It was an honor to share this with all of you. Have a nice day.